Hi, my name is Scott, and today I'm going to be teaching you about large volume nebulizers, which is also known as LVNs. So the first thing you do is you're going to be getting the physician's order for LVN for a patient, and we're going to be checking the patient's charts, and that can basically be like, telling us why the patient needs this treatment. So maybe like a upper airway bypass, or the patient has upper airway edema, and the patient has swelling of their upper respiratory tracts, so they might be needing this, or they really just have thick secretions. That's what we would probably be saying in the charts, and also have like trends and their vital signs. So after you do that, we're gonna gather our necessary equipment. So we're gonna have 2 corrugated tubings, and then we're gonna have the large volume nebulizer right here, and this is gonna be set at what the physician gives us, which is at 30%. And it's going to be at 5 to 8 liters per minute, and this is already fixed if I were to, but if it wasn't, you could calculate it with like the magic box. And yeah, so we're also going to have hand sanitizer. We're going to be checking vital signs, just the regular saturation levels, and we also have the water trap for the condensation buildups, and a simple mask. Yeah. Okay, so indications, I already went through it. Hazards that can happen is that you can have overhydration, or bacteria can build up in case if you're setting this up wrong, or there's just too much water, which can build up bacteria and can do harm to patient. Okay, so we're gonna wash your hands, and there's no sink, so you can use hand sanitizer. And you want to make sure that you rub your hands till it's dry. So maybe like 20 seconds, 15 seconds. So after that, make sure to put your gloves on. Okay, so we're going to knock on the door. Excuse me, can I come in?
Yes.
Hi, my name is Scott, and I'm a student respiratory therapist, and I had an order to come and give you a treatment for large volume nebulizers. Can I have your first name and your last name, please?
Daniel Owen.
Okay, Mr. Owen, and can I also see your wristband? Thank you. Okay, I'm gonna call you Mr. Owen, okay? All right. So today, how's your breathing feeling in your throat? Are you in pain? Are you uncomfortable?
No, not in pain right now.
Not in pain. Okay. So do you feel like you have a lot of things like secretions or mucuses?
Yeah, it feels a little congestion.
Okay. So the physician ordered us to bring you, basically just to like give you more movement in your upper respiratory tract area. So you're gonna be able to after this treatment, you're gonna be able to like cough them up more, and you'll feel a little more free. You know, loosen it up a little bit so you can actually talk and breathe a little better. Yeah. Okay. So I'm gonna be checking your vitals first. So is it okay if I do that?
Yeah.
Okay. So, scan here, please. Thank you very much. Okay. And I'm gonna actually press it on your chest right there. Okay. All right. And then I'm gonna be checking your. Okay. So your heart rate was basically 80. I took 40 and I times it by 2. So 1 minute, you listen to patient's pulse for a minute. And the respiratory rate, you don't tell them that you're actually taking the respiratory rate, so they don't breathe differently in case they're like kind of scared or they're anxious. So I did that already without telling the patient, and it came out to like basically 16, which is in the normal ranges, and the saturation level was also at 98, which is perfect. Thank you very much. So I'm going to start setting up your treatment, okay? So yeah, I'm just going to show you this. So yeah, the patient ordered for 30%, which is right here. You kind of have like a little cheat sheet to tell you, and then it tells you how many liters. So since we're at 30, it's going to be 5 to 8 liters per minute. So we're going to put it over there. Good over here? Yeah? Look comfortable. Alright. So corrugated tubing. When you put these on, you want to take your time. These don't want to go on the floor. If they touch the floor, then you know what? Go get a new one. Make sure you do that. Alright. And the air trap. We also have like little part of there, and that's just to get rid of like so when it's filled with water, you want to open it for like respiratory therapists. You want to open it and just drain it, and then yeah. Okay, and then every second one. We're just gonna go into the mouthpiece and into the other part of the T-tube. Now, when you're putting this on and you're putting it on the bed, you want to put it on the lower part of the rail. And the reason why is because you want to make sure when water is coming out of it or it builds up condensate, that it does go into the bag to lock the trap. Because if it doesn't, then it will just stay right here, or it can actually go back into the patient, and it can, yeah. And don't forget, you have to check to see if it's working. So give me 1 second. Okay. So the way you check is you want to feel it and you want to see it. Like, you want to see it nebulize out like aerosol or anything. You can also check on yourself. You can see it. In the video, you probably won't be able to see it. Okay. Alright. And then after it's set, I want to talk about the particle size real quick. Is that we give an aerosol like this. It basically turns water particles into aerosol like gas form, which is like mist. And this actually, we use larger particle sizes for upper airway tracts than we do with lower respiratory tracts, which is we use smaller particles so they can go down to the alveoli. So yeah. So I'm gonna do this. Yeah, okay. So we leave the treatment on for about like 30 to 45 minutes, and then as the treatment's going on right now, we're gonna also reassess, check the patient. That way we can see if they're tolerating it okay, if they have signs of dyspnea or cyanosis, to see if they're okay with the actual treatment. So Mr. Owen, is it okay if I check your immune system? Yeah. Okay. So we do the same thing. This on your finger. Your oscillate. And look down. Through there. Okay. One more time. good. So I think you'll be okay. And I'm gonna actually check your lung sounds from the front, just to see if there's any more like any difference. There might be, there might not. So yeah, is that okay with you?
Sounds perfect.
Let me just open this up. Deep breath in, please. Okay. One more time. Okay, and just do one bite. Okay. And the button up there, yeah. Right. Alright, so again, you're having this treatment for, like I said, 30 to 45 minutes. Is there any questions you want to ask me? Are you feeling okay?
No questions and I feel fine.
Yeah. Okay, so I'm gonna leave. There's a call button on here, and then your also is leave you another one here. If you have any questions or you need any help, you can hit the call button and they'll bring us in. But I'll also be back here in about 30 minutes to check up and see how you're doing. Okay?
Sounds good.
So at this point, you're gonna step out, take off your gloves, throw them away, and then wash your hands again. No sink, use hand sanitizer. At this point, we reassessed already, and the patient's gonna be like hanging out for about like 45 minutes, 30 minutes after treatment is done. So after you walk out of the room, you're gonna chart. You're gonna write your findings if there's anything new or anything that we didn't know earlier. So also write out their vital signs and trends, and yeah, come back and do the same thing. Check up on them and then write it again. So thank you for watching our video.